Hi, hello, welcome to the lung page. Today we are going to see another interesting chest X-ray challenge number 17. So this is a chest X-ray. So 43-year-old male diagnosed patient with high HIV. He is on treatment and also diagnosed as a semipositive pulmonary TB. He is on treatment. He presented with 1 week history of fever, cough and exertional desaturation or exertional dyspnea. So when we took a chest X-ray. So this is a chest X-ray. So how can you explain this chest X-ray? What are the explanation and what is the possible diagnosis or differential diagnosis? Okay, as we all know, so this is this chest X-ray. Airway, okay, normal. Bones, everything's normal. Cardiac contour normal. There's no effusion. Chest diaphragm is normal. And also when you see the lung field, here, this is patchy opacities involved in the mainly in the perihyal area is involved in the central to periphery, right? Central to periphery. You see, it's like a periphery area, central to periphery. Patchy opacity mainly involved in the upper lobe, middle lobes, right? Lower lobe also a little bit involved, right? Mainly involved in the upper and middle lobe. Okay, so this is called bat wing appearance, right? So it's like a bat wing appearance. You can see here, it's like a bat wing, right? Bat wing. So this is it's like a bat wing appearance. Also involved in the this is like a patchy inflammatory shadows. Okay, patchy inflammatory shadows. So according to this history and extensional dyspnea and cough, the patient has HIV. So what is our thought? So most probably this patient has PJP pneumonia. What is PJP? Pneumocystis jirovecii pneumonia. So the chest X-ray appearance is perihilar patchy opacity with bat wing appearance mainly involved in the mid upper lobe and middle lobe involvement. So it's most likely diagnosed is PJP pneumonia. So, what is PJP pneumonia? We have to know about that. So, very quick fact about PJP pneumonia. So, PJP pneumonia is one of the fungal infection. Okay, almost remember this is a fungal infection. So, risk factors are mainly HIV patient CD4 count less than 200, with the patient on long-term steroid, transplant patient or cancer therapy or immunosuppression. So these patients are very prone to get this PJP pneumonia. Symptoms mainly fever, dry cough, breathlessness, exertional desaturation, and fatigue hypoxia. These are the main clinical symptoms. So how can you going to investigate and how can you diagnose this patient? So when you take imaging, HRCT is the best mode of imaging, right? When you take HRCT, this is a diffuse bilateral granular opacity, central and peripheral, associated with cystic involvement, mainly in the upper and middle lobe and peripheral area, right? So with that, we'll suspect this is a pneumocystis jirovecii. Also, we have the another diagnosis clue. We do the sputum toridine test and BAL for the PJP PCR. These are the definitive diagnostic tests for BAL PCR. And also elevated beta glucan is support the diagnosis. And also we have to do the ABG increase LDH level and hypoxemia also suggestive of, and also leukopenia also suggestive of PJP pneumonia. So when you come to the management point, Cotrim is the first line treatment. If the Cotrim allergic, we can go for second line like permethrin. And also the patient is steroid. What are the indication of steroid in PJP pneumonia? Is patient have hypoxia, PaCO, PO2 less than 70, and also AA gradients more than 35. And also we have to manage this patient with the oxygen supportive care. And also this patient have a when these high risk patients may need a prophylactic treatment of Cotrim. Okay, I think now you people are very clear about this PJP pneumonia and also PJP pneumonia chest X-ray. Okay, stay tuned. We'll do the another interesting chest X-ray and explanation. Okay, bye.